This is a demonstration of Prototype B for the Medicaid and CHIP Quality Rating System, also referred to as the MAC QRS. The prototype illustrates the proposed requirements in the 2023 Medicaid Managed Care Rule related to the MAC QRS website display. These requirements were informed by extensive consultation with beneficiaries and their caregivers through iterative testing of a website prototype and with states through listening sessions and work groups. You can read a detailed account of this beneficiary feedback in the preamble of the proposed rule in the section called MAC QRS Website Display. CMS is proposing to implement the website display requirements in two phases. Prototype B is designed to be an example of the second phase, which is an interactive website that includes both the display features from the initial phase, illustrated in Prototype A, and the more technology-intensive features CMS is considering phasing in. Keep in mind that states may choose to implement Phase 2 requirements during the initial phase of website development, so long as that website meets the initial display requirements. The proposed requirements for the QRS website display would be found in Title 42, Part 438, Section 520 of the Code of Federal Regulations, or CFR. Throughout the demonstration, we use a red cursor to highlight the design elements in Prototype B that correspond to the design element numbers used in the Prototype B PDF document. The design element numbers identify where in the prototype an example of a proposed website display requirement can be seen. These design elements also correspond to the citation map, which links each design element to the proposed requirements in 438.520 and provides the page number of the prototype where the element can be found. Both of these resources are located on the MAC QRS website on Medicaid.gov. We propose several requirements to help the website user navigate and understand the components of the MAC QRS. In this prototype, we have made a number of these requirements immediately visible on the MAC QRS landing page to quickly orientate users. The first of these requirements is a statement of purpose for the MAC QRS. In this prototype, the purpose of the quality rating system is clearly stated in 4 bullets predominantly displayed on the top of the landing page. Second, we are proposing to require that relevant information on Medicaid and CHIP and Medicare is provided. There are 2 boxes on the right side of the landing page to refer the user for more information about Medicaid and CHIP if they need it. The first box links the user to information on Medicaid and CHIP eligibility, and the second box directs the user to resources on how and where to apply for Medicaid and CHIP. We chose to provide information on Medicare in a different section of this prototype when it may be more useful to the user. We are proposing that states provide an overview of how to use the information available in the Medicaid QRS website display to select a quality managed care plan. This prototype requires users to enter user-specific information in order to view only those plans that are available to the user based on information provided. Starting with entering a zip code, the user will proceed through 5 steps identified on the next page that guide the user through how to compare plans on various dimensions, such as covered benefits, costs, available doctors, medications, and quality of care, including experiences of current Medicaid managed care plan members. We are proposing certain information be displayed that allows beneficiaries to identify managed care plans available to them that align with their coverage needs and preferences. Specifically, we propose to require information that would allow users to identify all available managed care programs and plans that may be eligible for based on geographic location, age, and dual eligible status. States could choose to incorporate other eligibility factors beyond these three if applicable. In this prototype, the user begins by entering their zip code to see all available managed care programs and plans for which they may be eligible based on geographic location. For this demonstration, we have used a zip code from New Hampshire as the example. Clicking on the Next button brings the user to a page where they will need to indicate their age group to see all available managed care programs and plans for which they may be eligible based on geographic location and age. Notice that the search criteria at the top of the page indicate filters applied to comparisons shown in these displays. This information is displayed at the top of each subsequent page. For this demonstration, we have selected the age groups child and adult under 65. Before we move on to the next page, we want to highlight several features on this page that you will see in the remaining pages of the prototype. First, we propose to require an overview of how to use the information available in the website display to select a quality managed care plan. In Prototype A, this overview was provided by listing out various steps that a user can take to select a quality plan. Because this prototype is interactive and not a single page, the overview requirement is implemented using a navigation bar at the top of the page, designed to help the user move through the various sections of the website. Next, we propose to require states provide information on how to access the beneficiary support system to answer questions about using the MAC QRS. At the top of each page in this prototype, a toll-free number for the beneficiary support system is shown. Unlike Prototype A, which is a static page that links out to information, the interactive nature of this prototype requires users to enter such information on a number of pages to display relevant information. Under our proposal, if a user must enter user-specific information to access or use the quality rating system, an explanation of why the information is requested, how it will be used, and whether it is optional or required must be provided. Such an explanation is provided on all Prototype B pages where the user inputs user-specific information. Finally, we're proposing to require information or hyperlinks directing users to resources on how and where to apply for Medicaid and CHIP and enroll in a Medicaid and CHIP plan. Just below the navigation bar, the hyperlink at the right directs the user to resources on how to enroll in Medicaid or a CHIP plan. Okay, we're ready to continue navigating through this interactive prototype. Clicking on the Next button takes the user to a page for entering other information associated with identifying plans for which the user may be eligible based on age. On this page, the user enters additional information about the child beneficiary. While the MAC QRS is not an eligibility determination website, this prototype seeks to ask simple questions to help users identify and compare plans they may be eligible for. Clicking on the next page takes the user to a page for entering additional information associated with the adult age group to see all available managed care plans for which they may be eligible. The questions on this page are designed to identify whether the adult beneficiary may be duly eligible for Medicaid and Medicare, which would impact the plans available to the beneficiary. Again, the MAC-QRS website is not meant to determine eligibility, but can provide more relevant information to users through these types of questions. For this demonstration, the user is duly eligible for Medicare and Medicaid. By selecting the I Receive Medicare option, the user will be shown information about plans that are available to those who are duly eligible to receive Medicare and Medicaid. Now that the user has selected their search criteria, let's explore the pages displaying information about managed care plans by clicking on the Next button. We are proposing a list of standardized information that states would display to allow users to compare available managed care plans and programs on covered services, costs, extra benefits, and other metrics of managed care plan performance. Following along with the navigation bar at the top of the page, we see the user can use the current page to compare health benefits and costs among available plans. Below the navigation bar, there is a drop-down window that, when selected, provides users a simple overview of costs that may be the same for all plans and costs that may differ from plan to plan within a single program. By clicking on the arrow again, we return to a page that lists the covered services for all plans. We are proposing to require states to display a summary of benefits, including differences in benefits among available managed care plans within a single program. The table displayed on this page provides a list of covered services by all plans. Further down the page, we look at the cost of covered services for each available managed care plan. The table shown includes the name of each managed care plan, which we are proposing to require, as well as the website and telephone number of each plan. We are also proposing that states would be required to display premium and cost sharing information, including differences in premium and cost sharing among available managed care plans within a single program. Below each plan, a table shows the cost of covered services for each managed care plan. The table on this page allows the user to easily identify differences in premium and cost sharing for covered services among available health plans. We are proposing to require states to display a summary of benefits, including differences in benefits among available managed care plans within a single program. Extra benefits or value-added services are services offered by plans at no additional cost and in addition to the Medicaid basic benefits. Beneath each plan, similar to the previous table, this table allows users to easily identify differences in categories of extra benefits among plans. The next sections of the prototype B allows the user to compare the plans, providers, pharmacy costs, and quality ratings. The user starts by clicking the Add to Compare Plan button above each health plan's name. Then clicking the Search Providers button at the top of the page. We propose to require provider directory information for each managed care plan. We also propose that in the second phase of the website display implementation, states would be required to provide a search tool that enables the user to identify available managed care plans that include a provider identified by the user in the plan's network of providers. This page displays both of these requirements. First, an example of a provider search tool is provided. For this demonstration, we will search for the provider Jane Doe. Based on this search, the prototype shows which plans cover the provider identified by the user. Additionally, the prototype provides a hyperlink under each plan's name and description, directing the user to its provider directory. Under our proposal, this information would include at least all the information required under existing managed care regulations at 438.10 H1 and 2. We note that states have the option to implement this search tool prior to the second phase of website implementation. Next, the user may search for prescription coverage for each managed care plan by returning to the navigation bar and clicking on the Search Prescriptions button. We propose to require a description of the drug coverage for each managed care plan. We also propose that in the second phase of the website display implementation, states would be required to provide a search tool that enables the user to identify available managed care plans that provide coverage for drug identified by the user. Both of these requirements are illustrated on this page. This page starts with a drop-down arrow that, when selected, provides general information about Medicaid and CHIP pharmacy coverage. Selecting the drop-down arrow again brings the user to a search tool to identify available managed care plans that provide coverage for a drug identified by the user. For this demonstration, we will search the prescription Lexapro. The prototype shows coverage, including copays for the 3 managed care plans. In addition to the prescription search feature, the page includes a hyperlink below the plan's information that will bring the user to the plan's drug list for each managed care plan. Under our proposal, this information would include at least the formulary information specified in managed care regulations at 438.10I. By returning to the navigation bar at the top of the page and clicking on the View Quality of Care and Members Experience of Ratings button, the user will reach the final section of the prototype that displays quality measures for all 3 plans. Our proposal would establish requirements for displaying quality ratings in the second phase of website implementation. For example, under our proposal, states would be required to display each measure stratified by the factors required in Phase 1, which are dually eligible status, race and ethnicity, and sex. And they would also have to add at least 4 additional factors: age, rural-urban status, disability, and language of the enrollee. We'd also require states to include an interactive tool that enables users to view the quality ratings stratified by each of the required factors. In Prototype A, we illustrated how quality ratings for measures and the stratification of those measures could be shown to users through a static PDF. In this prototype, we illustrate the interactive quality ratings and how the measures could be filtered. This prototype gives the user the option to select a domain that shows categories of measures and a view to show the quality ratings stratified by age. Clicking on the drop-down box shows all 6 domains. The domains in which measures are organized in the prototype include behavioral health and substance use, chronic conditions, home and community-based services, preventive health care, members' experience with the plan, and ease of accessing providers. We emphasize that we have not proposed mandatory domains in this proposed rule. Ease of accessing providers would include the data most recently reported to CMS on each managed care program, including the results of the Secret Shopper survey, which is information we propose to include in each state's QRS. For this demonstration, we will view the adult quality measures in the chronic conditions domain. The measure in the chronic conditions domain are now shown on the page. We propose to require states to include an indication if a plan offers an integrated Medicare and Medicaid plan, and a link to the integrated plan's most recent quality ratings under the Medicaid Advantage 5-star rating system. In our prototype, Acme Health is for those who are duly eligible for Medicare and Medicaid, and therefore a link to the plan's 5-star ratings for Medicare services is provided along with the required indication. We propose several requirements to promote beneficiary understanding of and trust in the ratings. First, we propose to require a plain language description of the importance of each performance measure assigned a quality rating. The display shows the measure's name controlling diabetes, followed by a definition and plain language description of the measure, the age group of the population included in the measure, and an indication of whether a higher or lower rate is better. We also see that no numeric ratings are shown for Prime Health. Under our proposed definitions, a quality rating means the numeric or other value of a quality measure or an assigned indicator that data for this measure is not available. In our prototype, Prime Health covers children and adolescents under age 18, and this page only includes quality ratings for adult measures. So instead, there's an explanation that Prime Health does not cover the population being measured. We propose to require states to display the measurement period reflected by the quality rating, and that information on quality ratings data validation, including a plain language description of when, how, and by whom the data were validated, must also be displayed. Below the navigation bar at the top of the page, a box contains two notices about the quality ratings. The first notice is the measurement period during which the data used to calculate the quality ratings was produced. The second notice provides information on quality ratings data validation, including a plain language description of when, how, and by whom the data were validated. Clicking on the Select a View drop-down menu will show you the views available. Here, the user can select a view to see the quality ratings calculated by the state for each managed care plan identified by dual eligibility status and race, ethnicity, sex, age, rural-urban status, disability, and language of the enrollee. We are proposing certain measures be stratified by these factors. By selecting different views, users can see quality ratings representing services provided only to plan beneficiaries that align with the participant selected factor. For this demonstration, let's choose sex option, which shows the quality measures in the chronic conditions domain stratified by sex, which is one of the stratification factors that we are proposing. Then let's show measures by race and ethnicity option, which shows the quality measures in the chronic conditions domain stratified by race and ethnicity. Finally, let's choose the by dual eligibility for Medicare and Medicaid option, which shows the quality measures in the chronic conditions domain stratified by dual eligibility for Medicare and Medicaid, another stratifier we're proposing. Finally, when the user is finished comparing the available managed care plans and is ready to enroll in a plan, they click on the hyperlink at the top of the page. The link will directly take them to resources on how and where to enroll in Medicaid or a CHIP plan. This concludes the demonstration of Prototype B for the Medicaid and CHIP quality rating system. We encourage you to use the comment period to provide any feedback to CMS on these proposals, and if you have not already, please view Prototype A and the associated demonstration, which represents that would be required in the first phase of implementation. Additionally, there is a citation map on the QRS website that can help map prototype features to the proposed regulations. You will find these resources and instructions on how to provide comment on our proposed regulation on the MAC QRS website on medicaid.gov.